Hello everyone, welcome back to my channel. In this video, I will discuss about the anatomy of facial nerve. The facial nerve is a mixed nerve. It consists of motor as well as sensory root. The functional components of facial nerve includes the branchiomotor fibers, that is spatial visceral efferent fibers, which supply the muscles developed from second branchial arch. It contains the preganglionic secretomotor fibers, that is general visceral efferent fibers for supplying the submandibular, sublingual, lacrimal glands and glands of soft palate and nasal cavity. It contains the taste fibers, that is spatial visceral afferent fibers, which are receiving taste sensations from anterior two-third part of the tongue. It is also containing the cutaneous somatosensory fibers, that is general somatic afferent fibers, which are supplying the skin of concha of the auricle. Now the origin of the nerve. It has superficial as well as deep origin. So first we discuss about the deep origin. The motor nucleus of the facial nerve is located in caudal part of the pons, and it represents the spatial visceral efferent column. It has three subgroups. The lateral one supplies the buccal musculature and buccinator. The intermediate supplies the orbicularis oculi, muscles of forehead and upper face. The medial group, it supplies the auricular muscles, occipitofrontalis muscle and platysma. The fibers pass dorsomedially, occupying the facial colliculus. As we can see in the diagram, these are the fibers of facial nerve, and they are passing dorsomedially and occupies the facial colliculus. That is the elevation in the pons which is created by the facial nerve nucleus. At the cranial end of the facial colliculus, this nerve bends abruptly downwards, forming internal genu and emerge at the lower border of the pons. So in the diagram we can see the emergence of the facial nerve at the lower border of the pons. It has superior salivatory nucleus which represents the general visceral efferent column. It gives origin to preganglionic secretomotor fibers which emerge through the sensory root. Also, it contains the upper part of nucleus of tractus solitarius, which represents the spatial visceral afferent and general visceral afferent column. These are depicted in the diagram. Upper part of spinal nucleus of trigeminal nerve receives cutaneous sensations from the auricle. Now the superficial origin of the facial nerve. Both the roots of facial nerve, they are attached to the lower border of the pons between the olive and the inferior cerebellar peduncle. Motor root is large and lies on the medial side of the sensory root. The sensory root of facial nerve is also known as nervus intermedius, which emerge along with the vestibulocochlear nerve. This root is lying between 7th and 8th cranial nerves, that is why it is known as nervus intermedius. Now, in a nutshell, the course of the facial nerve is depicted in this diagram. After taking origin from the pons, it enters into the internal acoustic meatus. In this, it runs in a bony facial canal and then it comes outside the cranial cavity through stylomastoid foramen to supply in the face. Now we discuss the course of the facial nerve in detail. The course of the facial nerve has been divided into two parts by the stylomastoid foramen. These are intracranial and extracranial parts. The intracranial part, it arises from the brainstem. Both roots of the facial nerve, accompanied by the 8th cranial nerve, pass laterally and forwards and enter into the internal acoustic meatus. In the diagram, we can easily see the emergence of the facial nerve from the brainstem, and then it is entering into the internal acoustic meatus. At the bottom of the meatus, the two roots of the facial nerve, they are united. to form the trunk which enters into a bony facial canal. In the bony facial canal, at first the nerve passes laterally above the vestibule. This is the vestibule of internal ear and reaches the medial wall of tympanic cavity, where it bends backward, forming the external genu. Genu means bend. So here the external genu is found, which represents a genicular ganglion. Now from the genu, the nerve passes backwards and downwards and lodging in a bony canal above the promontory and the fenestra vestibuli. So here we can see again a bony canal which is lying above the promontory. This is the promontory, and here we have the fenestra vestibuli on the internal ear. So then it reaches the medial wall of editus to mastoid antrum. So this is the editus to mastoid antrum. Then finally it passes vertically downwards along the posterior wall of tympanic cavity. This is the tympanic cavity where we have the different bones of the middle ear. And this nerve leaves the temporal bone through the stylomastoid foramen. So this is the stylomastoid foramen over here, through which this nerve is exiting out. Now the extracranial part of the facial nerve. After passing through stylomastoid foramen, the facial nerve changes its direction, passes forward superficial to the styloid process and pierces the posteromedial aspect of the parotid gland. So here we can see the facial nerve which is entering into the parotid gland after piercing its posteromedial surface. Within the gland, the nerve runs forward for about 1 centimeter superficial to the retromandibular vein. Here we can see the retromandibular vein and the external carotid artery, and then it divides into two trunks. One is temporofacial, other is cervicofacial trunk. Now from these two trunks, 5 terminal branches arises and they radiate like the goose feet, which is known as pes anserinus. Now some points of spatial importance of the facial nerve. It possesses 2 genu. One is internal genu which is lying in the pons, other is external genu which is lying in the medial wall of tympanic cavity. It changes its direction 5 times. Stylomastoid foramen in adults lies about 2 cm deep to the middle of anterior border of mastoid process, while in case of children or in infants who are less than 2 years of age, the stylomastoid foramen is very close to the surface of the mastoid process because this process develops after 2 years. So the facial nerve is very close to the skin. Now the branches of facial nerve, the communicating branches of the facial nerve, they are first which arise in the internal acoustic meatus. So it communicates with the 8th cranial nerve in the internal acoustic meatus. At the genicular ganglion, it provides the greater petrosal nerve. In the diagram we can see the greater petrosal nerve. This is the greater petrosal nerve which is carrying preganglionic secretomotor fibers to the lacrimal gland and glands of nasal mucosa and the soft palate. It also conveys taste fibers from the soft palate. So in the diagram we can see the arising of the greater petrosal nerve which is supplying to the pterygopalatine ganglion. Now postganglionic fibers supplies the lacrimal gland and the soft palate. Now the next nerve which is arising from the genicular ganglion is the lesser petrosal nerve. This lesser petrosal nerve relays in the otic ganglion and thereby it supplies the parotid gland. Next, the third branch arising from the genicular ganglion is the external petrosal nerve. This external petrosal nerve forms sympathetic plexus around the middle meningeal artery. So in the diagram we can see this is the external petrosal nerve which is forming a plexus around the middle meningeal artery. Then in the facial canal, it provides a communicating branch with the auricular branch of the vagus nerve, So in the diagram we can see this is the communication between the facial nerve and the auricular branch of the vagus nerve. Now below the stylomastoid foramen, it provides communicating branches to the ninth cranial nerve. So in the diagram again we can see an anastomotic network of glossopharyngeal nerve and the facial nerve. Then there is anastomosis between the facial nerve and the great auricular nerve, and another anastomosis between the facial and the auriculotemporal nerve. Now behind the ear, it anastomoses lesser occipital nerve. In the face, it provides communicating branches with the fifth cranial nerve, that is the trigeminal nerve. Next, in the neck, it provides a communicating branch with the transverse cervical cutaneous nerve. Now the branches of distribution of the facial nerve. First, in the facial canal, it provides two branches. One is nerve to stapedius, which is supplying to the stapedius muscle. Another is the quadra tympani nerve. The quadra tympani nerve arises from the facial nerve 6 mm above the stylomastoid foramen. So here we can see the origin of quadra tympani nerve, which is lying 6 mm above the stylomastoid foramen. It conveys taste fibers from the anterior two-third part of the tongue, except the valate papillae, preganglionic secretomotor fibers to the submandibular and sublingual glands. Second is, it is providing three branches below the stylomastoid foramen. These are posterior auricular nerve. Here we can see the posterior auricular nerve. Then a nerve to posterior belly of digastric and stylohyoid muscle. So these are the three nerves. The posterior auricular nerve supplies the intrinsic muscles of the cranial surface of auricle, auricularis posterior, and occipital belly of occipitofrontalis muscle. Then it is also supplying a branch to posterior belly of digastric and a branch to stylohyoid muscle. Then there are 5 terminal branches in the face. First is the temporal branch. This is providing innervation to the intrinsic muscles of lateral surface of the auricle, auricularis anterior and superior muscles, upper part of orbicularis oculi, frontalis and corrugator supercilii. The zygomatic branch provides innervation to the lower part of the orbicularis oculi. The buccal branch provides innervation to the zygomaticus major and minor muscles. Also, it is providing innervation to the levator anguli oris, levator labii superioris, levator labii superioris alaquae nasi, muscles of nose, buccinator, and orbicularis oris. The mandibular branch, that is the marginal mandibular branch, it is providing innervation to the risorius, depressor anguli oris, depressor labii inferioris, and mantalis muscle. The cervical branch provides innervation to the platysma muscle. So here we can see in the diagram the emergence of 5 terminal branches from the facial nerve. Next, come to the applied aspects. The lesions of the facial nerve may be supranuclear, nuclear, or infranuclear. First, supranuclear paralysis. That is, the site of lesion of the facial nerve is lying because of the injury of upper motor neuron, that is the corticobulbar and corticoreticular fibers to the facial nucleus. It is caused by the occlusion of blood vessel which is supplying that particular motor area which is controlling the facial muscles. It results in paralysis of lower facial muscles of the contralateral side, but the upper facial muscles are escaped. This is due to bilateral control of motor cortex to which supply the upper facial muscles. Then the nuclear paralysis. The site of lesion includes in the pons which involve the motor nucleus of facial nerve along with the abducens nerve. It results in lower motor neuron paralysis, producing paralysis of facial muscles on the affected side with medial strabismus because of involvement of lateral rectus muscle. Sometimes pyramidal tract of facial nerve are involved, characterized by contralateral hemiplegia and ipsilateral facial palsy. This is termed as Millard-Gubler syndrome. Now the intranuclear paralysis. A lesion of peripheral part of facial nerve is known as Bell's palsy, which causes lower motor neuron paralysis of all facial muscles on the affected side. Its manifestation vary according to the site of injury. They are: first, when there is lesion in internal acoustic meatus, it causes the Bell's palsy along with deafness. Deafness is because of involvement of 8th cranial nerve. Second is when there is lesion at genu, it will cause Bell's palsy along with diminished lacrimation, submandibular salivation, reduced taste sensation from anterior 2/3 part of the tongue, plus hyperacusis. Hyperacusis is because of paralysis of stapedius muscle. Then the third one is lesion between genu and pyramidal eminence produces all signs which are given in the second point without disturbance of lacrimation and taste sensations from the soft palate, because the branches for lacrimation and the taste sensation from soft palate, they are emerging before the genu part. So this escapes these structures. Next is injury below the stylomastoid foramen. If there is injury of the facial nerve is occurring below the stylomastoid foramen, it will cause Bell's palsy without affecting other functions. The causes of Bell's palsy are sudden exposure to cold, middle ear infection, fracture, tumor, or from other disorders. These are the following manifestations which are observed in case of Bell's palsy. There is transverse wrinkles of forehead disappear and the eyebrow droops. Palpebral fissure is wider than that of normal side. Patient unable to close his eyelids and the tears roll over the cheek. Corneal reflex disturbed. When an attempt is made to close the eyelids, the eyeball on the affected side may be seen to roll upward. This is known as Bell's phenomena. Nasolabial fold disappears and the tip of nose is deviated to the sound side. During smiling, angle of mouth remain motionless on the affected side. Due to paralysis of buccinator, food accumulates in the vestibule of mouth and occasionally dribbles out. So these are the manifestations which are observed in case of Bell's palsy. This completes our topic. Thanks for watching.